It's my great honor to have Dr. Duffy here with us as our guest. Duffy, why don't you tell us a little bit about yourself?
I'm just this average guy. When I was in high school, I wanted to be an actor and director, so I went to NYU for acting and directing, and I graduated there, and didn't really put a lot of effort into that, but I did have a blast in New York City when I was in my teens and early 20s. And then at around 25, I just sort of figured, well, I need to do something else with my life. So I pursued medicine and, did all the prerequisites for it, did a lot of research and did a lot of work in chemistry and genetics, and landed a spot at Mount Sinai School of Medicine, and then the rest is history. Now I'm a plastic surgeon that is in Southern California.
Yes, welcome. Dr. Duffy just moved from South Carolina here 2 years ago. Mm-hmm. Before pandemic, right?
Right before the pandemic, yeah. I got here the Thanksgiving before, took a few months off just to sort of enjoy myself and relax into my new environment, and then kaboom, the lockdown and pandemic.
All right. So there's so much we can chat about today with the fitness and everything. So why don't we start from... So you came to me, so now it's like 8 months ago?
I think I started working with you in June, and we're now...
Yeah, December, so 6 months ago.
6 months ago.
So what brought you to me?
I, like most people, when lockdown occurred, my nutrition and fitness just became less than ideal. I love to cook. I'm a baker by nature, so I thought, I've got all my solitude, I'll tackle sourdough and how to bake things like treats and things like that. And you do that, and I gave away a bunch to my neighbors. They actually started to lock their doors as I started to show up with loaves of bread and stuff.
No. But when I turned 48, Dr. Duffy baked me the best flourless chocolate cake. I love it so much. You're gonna ask the recipe and learn how to bake that. But thank you so much for my birthday cake.
Oh no, it was a pleasure. I'm really glad you liked it. Hopefully everybody enjoyed it. And I had.
So could you share with us, during pandemic, how much weight gain you had, and then with everything?
I was probably right when I moved here. I took about a little bit over 30 days to drive just cross country. I packed what I absolutely needed and kind of camped my way across country, staying every now and again in a hotel. But I had been working with an online trainer, and we would focus on strength, and I wanted to bulk up a little bit in terms of muscle mass. So I just made the commitment going cross country that I'm going to follow his nutritional regimen and his workout regimen. And it was a really neat thing about going cross country, because I would find a local gym, try and not find anything like a Gold's or a big national chain gym, and that way you got to see a little bit of another slice of life of Americana, meeting people there, and it also kept me really on par with my nutrition. So when I got to California, I was probably about between 210 and 215 pounds. And then over the course of the pandemic, people were like, oh, you're going to gain 5 or 10 pounds. I think I made it up to 240 was my highest weight.
So 25 pounds.
Probably, yeah. Over the course of a year and a half, 2 years of pandemic. And it's insidious, it really sneaks up on you, because I'm a doctor, you're wearing scrubs all the time, and, it's basically like wearing elastic pants. They're just like, your girth gets wider, you don't even realize it. And then all of a sudden one day you put on your pants and you're just like, oh, somebody snuck into my house and shrunk all my clothes. And so it really just got to the point. I think it was as I was approaching 240, because you kind of always do the thing. It was like, okay, it was 215, now I'm 220. Okay, let's be good. Oh, I'm 225. Well, I'm stressed. There's a pandemic going on. Oh, I'm 230. Oh, there's unrest in Washington D.C. I'm stressed. Not a good time. Nothing that a long soak in the tub and pizza won't take care of. And then as I approached 240, I just spoke to the man in the mirror, and I said, hey buddy, you need to take care of this now. So that's when I reached out to you. Some of the people I work with, my office manager, she's a regular client of yours, spoke very highly of you, and I'd never really worked with a personal trainer before.
I'm the first one.
You're the very first. I've worked with some online trainers that have given me some workout routines and some dietary regimens, but I've never really had anybody that's really like, face-to-face accountability for it. And I think that was a huge thing that I need, in order to keep me on track. Because I think when I mentioned to you when I started, consistency was the huge thing that I really needed to work on. And I think, I joke with people like, Americans were the great bingers. We learned to binge drink in college, we're binge eaters and things like that. And we binge exercise too. There's a function, there's a wedding, there's a reunion, there's a music festival. And you're like, okay, for the next 6 weeks, I'm not going to eat. I'm going to exercise every day, and I'm going to sleep in a sauna. And then,
Great American.
Yeah, and then, you go to that festival, and then as soon as it's over, it's like, all right, and then you kind of yo-yo back and forth. So that was the real thing I was looking for, and I think we talked about it was, I need to really incorporate a consistent regimen. And my big concern, I think I spoke with you, especially about nutrition, was, if you tell me, here's your very restrictive nutrition regimen, I'll do it for 4 weeks, and then I'll run away screaming and never see you again, So that's what I really wanted to avoid. And I one of the things I always brag about with you was the way that you kind of, you were very sly, the way that you snuck nutrition into me. Very sly.
Sneaky Fen.
Well, it was great because, we started off and all you said was, I remember because I got it all written down, it was, no break room snacks, because working in hospitals, working in offices, someone's always brought cheese and crackers, cakes, pies. My office too, and like my office manager Val, she's got really good taste. So when she's got cheese, it's really good cheese. You're gonna enjoy it.
Well, she got bakery goods. It's all the best French bakeries.
Oh yeah, she basically, if I say I need something, she'll tell me where it is, and I'll go, I'll drive to Santa Monica for it, but you get it, and you're like, wow, this is actually the best sliced ham I've had in my entire life. So it's really great. But you basically said no break room snacks. You can sit down and have a meal in the break room, and let's just keep it to 2,000 calories a day. And I said, well, was it 2,000 calories? So like this much protein, what should that be? And you just basically said, no, I don't care if you eat 2,000 calories of butter or 2,000 calories of cauliflower. That's just it. So, I did that for a couple of weeks, and that was the first couple of days was a little bit of struggle, and I suddenly realized, wow, my estimate was off. I was taking in more than I thought. My portion control was really out of whack and out of sync with reality. And then about 2 weeks later, that was under control, and I was comfortable with that. And then you said, okay, 2,000 calories a day and 40 grams of fiber a day. And I was like, okay. And that took a little while because, again, I looked at what, I started journaling everything. I said, wow, I thought I was giving myself more fiber and things. A lot of these foods that I thought were higher in fiber weren't. So that adjusted, and it took about 2 weeks, and that was normal. And then you said, very good, now 200 grams of protein a day, and that was 2 weeks of that. And that was a little bit of a challenge the first couple of days. But then you get into your routine, and your body adjusts to it. And then I remember like a couple of weeks after that, and you said, okay, now let's just keep it to less than 20 grams of sugars, not carbohydrates, sugars a day. And I went home and I did my journal for a couple of days, and I got back to you and I said, I'm already under 20 grams of sugar a day with the fiber and the protein. I'm basically eating, lean meats and vegetables and very little grains and stuff like that. And you said, very good, we're done. And that's what I thought. I was like, well, that was kind of insidious. But if you had literally started with me and said, hey, you're going to be doing this diet regimen of just basically vegetables, lean meats, very little grains, very little sugars and things like that, like I said, I would have done it for a couple of weeks and I would have gone crazy. The way it was just sort of like just giving me one little project, letting me figure it out, and just adding it by the time it was done, I was like, oh wow, I'm down to I've got a really, really sustainable diet that's working for me. So
that's great.
I thought that was like I said, it was insidious.
Sneaky Fen. Mm-hmm. But I think it's very important for all of us to understand that if we want to just completely change a lifestyle from this much to like completely restricted, we're doomed to failure. That's not ever going to work. So yeah, one little habit at a time, and then once that habit is ingrained to the lifestyle, feel very comfortable piece of cake, and then go to the next, small habit change and everything. From my experience, your progression is fast. For most of the clients, they probably each habit will take probably 4 to 6 weeks, to get into, even just a no break room snacks. That was hard, but you nailed that like in 2 weeks.
Yeah, I mean, so things like that. I mean, something like that, that's a very, yes or no thing, or, very binary. It's just like you walk into the break room, and as you walk into the break room, the little voice in your head is just like, I don't care what's there, you're not going to touch it. And sometimes it was hard. Sometimes I was like, dang, wow, look at you. You brought nachos. Those look good. Oh, you got some for me. No, I gotta leave. That was doable. Yeah, I think the hardest part for me was when you added the protein to it, because that was a fair amount of protein that I was
200 grams.
200 grams for me, and that really took a lot of adjusting. That probably took me about 2 weeks to figure out how to do it without getting to the point where it becomes 8 o'clock at night and you're like, oh my gosh, I have to have 75 grams of protein before I go to bed, which is never what you want to be in. But then you figure little tricks like, okay, I wake up first thing in the morning and I have a protein shake, just to get the metabolism started. It worked well for me.
So share with us, because for most of us, we don't know what does 200 gram protein look like, or how is that. So everybody's fitness goal is different, but for you really like to have the mass, and everything. So that's why we designed this 200 gram of protein. So tell us about what's 200 gram, because that means nothing. What does it look like in a day? And what do you do?
For myself, to make sure I get 200 grams, I'll wake up and I will have a protein shake, and that's a 50-gram protein shake.
So like 2 scoops of the protein.
2 scoops of protein. It's the one that I use. It's 25 grams per scoop, so 2 scoops of that. And just use water to get that in. So that gets me started. I'll have another shake like that after my workout as well to do that in. So that's basically 100 grams out of the way. And then I just figure, for the 3 meals that I have, I need to have about 30 grams of protein. A can of tuna has about 25 grams of protein. One of the, not the gigantic cans, the regular cans. Yeah. 6 ounces of chicken, which I think the normal serving of chicken is considered about 3 ounces, but in America, if you ever went to a restaurant, they served you a 3-ounce portion of chicken, you'd throw the plate at them.
Yes. So basically, if you order a chicken salad for lunch, that's about 6 ounces. Yeah,
and that's going to give you about 30 grams. So that's it. So like I said, the trick was, at one point I tried to say, well, can I do this without adding a protein shake, without adding a bunch of whey proteins, what I usually use, into it, and that just became too cumbersome. I mean, I was just, when I was trying to do that, I was, almost forcing myself to eat, which is never a good thing. So that was just I'm going to be up at 6 o'clock every morning, no matter what, and having my protein shake. But it's nice; it gives me a little hour to do my crossword puzzle and have some coffee and relax for the day, or get ready to come and work out with you, since we usually do that around 7 in the morning, and that's it. So it's not I said with a little bit of planning, it's doable. I don't think most people would be taking 200 grams of protein in a day. No. That's a high thing. And I also, I'm aware too that with that amount of protein, I really need to make sure that my water intake is up too, because that does put a little bit of strain on your kidneys. So you got to make sure that you got enough water going through.
So how much water for the people that you like to, really have the good muscle mass and bulk up? So for that amount of protein, how much water you drink? I'm
trying to make sure I have at least 1.5 gallons of water a day. So, and I've always just been a big
So like
water
equivalent drinker. To like how many cups of water? So people understand.
Of glasses of water, of this size glasses of water, the normal tumbler of water, that's about 12, I think. I think it's 12 to 15.
Yeah.
12 to 15.
Yeah, so, if you have high protein intake, it's good to have 12 to 15, or 10 to 15, depends on your size, that.
Well, just water in general. I mean, especially, living on the I noticed a huge change living on the East Coast for so long, where it's, you know, the land of rain and humidity, and then living in Southern California where it's so dry. My first couple of months here, I was just thirsty all the time, and, you know, suddenly, you know, it clicked. I was like, oh, Einstein, you're living in a place where your sweat's actually working and being evaporated off your body. You're losing to the air. You got to drink more. Yeah.
So actually, from a plastic surgeon point of view, how important water is for our look, for our skin health, and for everything?
Everything. You come to me with a complaint, and I'm going to basically say, are you drinking enough water? Especially, you know, around, you know, with fine lines around the face, you know, dehydration is a big culprit. I always tell people, you know, especially when they're talking about skincare with me, I was like, 3 things. You drink your water, don't smoke, and go back in the time machine, and when you were 12, don't go out in the sun and get sunburned. So 2 of those things you can take care of. The sun exposure we had when we were kids, difficult. But I always tell people, you know, the sun, hydration, and avoiding cigarette smoke is going to be the biggest things that will help, you know, not just your lips, your body, everything. You know.
All right, so we'll get the youthful skin tip from Dr. Duffy.
Yeah.
And so talk about the sun. Like I like sun. I love sun. You know, vitamin D, all the good thing, and like, you know, some tanning color.
Yeah.
And but it's, you know, it's detrimental for your wrinkles. So how to do that, and what's a balance?
Yeah, I mean, I always think that sun is a very interesting thing. You know, and the switch with, you know, beauty that happened in modern times. You know, you think in the pre-industrial revolution era, beauty was considered to have fair skin. Tan skin was considered to be...
I know, more working class.
Working class. If you were tan, you were working in the fields. If you were pale, you were able to not work in the field. So it became a sign of status to have the pale skin. And then there was the, you know, with the Industrial Revolution and turn of working inside, it then became necessary being able to afford a vacation somewhere where I can afford to be outside, where I can afford to lay out in the sun and bask. And that's when the tan became a much more desirable thing. You know, it's sort of starting to switch a lot now, because now a lot of people are, you know, while the tan is still considered an ideal thing, and, you know, to my eyes, and I think to most people in this country's eyes, you know, somebody with white skin will look a lot better if they're tan. It just gives a lot more of a, I guess, an aura of, you know, health, of activity, of somebody that's really,
but from
enjoying life.
The little vein, you know, point of view, with tan color skin, you look more cut.
You look skinny, dark.
If a photo shoot, I'll be just like sun.
Yeah, dark things. Well, I tell people, like, when I got people that are doing a photo shoot, you know, that ask me about that, I just tell them spray tan. You know, spray tans have gotten better now, so we don't look like orange little Oompa Loompas, you know, when we've gotten the spray tans before.
So what's the strategy, like, you know, for us to, you know, we want to enjoy the sun, we want to get a good vitamin D's and everything, but still don't.
I think you need to.
You
really need to use. You need to use sunscreen. I mean, we just know so much that a lot of the skin cancer, the biggest risk factor for it is sun exposure. Except for a few very rare exceptions. So, yes, you go out and enjoy the sun. I go out and enjoy the sun, and, you know, I'm very, very pale. You know, the joke with a lot of my friends is I'm so white I'm almost clear. So when I go out in the sun, I make sure that I'm wearing, you know, 50 block or higher all over my body, and I'm reapplying it.
So tell us, because I had a lot of people ask me, is it like, you know, over 80 or over 50 SPF, does it make any difference? And then, so what do you recommend? Which number should we use?
I recommend 50 or higher. 50 or higher. I don't know of anything that's shown a huge benefit of 100 over the 50. I think the most important thing, if they're equivalent, the most important thing that people need to think about is the reapplication. And, you know, it's a pain, you know, to be out at the beach or out hiking or something, and you're busy doing activity and say, oh, okay, I need to stop and reapply sunscreen to myself. But you really need to make sure you're vigilant about that.
So if we're doing 50, and so how often should we reapply? Like we're in the beach and just lay there under the sun, but we perspire.
It's the perspiration that gets it. Even the things that are water resistant. I would probably say after about 3 hours.
3 hours.
3 or 4 hours is a reapplication. And even when people are not, like when I'm working with my clients in their skincare regimen, I'll remind them, yes, people are very good about applying their sunscreen on their face when they, before they leave their house in the morning. But I'll remind them, you need to do it at lunchtime too. Take a little second to reapply to your face, especially in, when you're living in a sunny climate like Southern California. You're just, it's our baseline. You're not aware of sometimes the amount of sun that you're getting.
So for instance, if in the morning I apply sunscreen on my face and I work inside the studio and sometimes outside, does that still count as 3 hours I should reapply?
In that situation, I would say that where you're not doing an outdoor activity, I would say that I would do the noontime reapplication for that, just to give yourself the extra coverage. Yeah.
So indoor, does that still count as sun exposure? Partial?
No, not really. I mean, is there some ultraviolet radiation that gets through glass? There is, but not to a large extent. Like where we're sitting right now, where no one in this room is getting any substantial ultraviolet, exposure from the sunlight, so that wouldn't really be a concern for it.
Okay, so those hours when I'm indoor, does that count as 3 hours? Or it's just 3 hours?
No, it's really like when I get to 3 hours, that's like when you're outside, when you're out hiking, when you're at the beach or anything like that. If you're doing like outdoor picnic or everything like that, yeah, you want to after about 2 or 3 hours, be thinking, okay, should I reapply?
And then, so those waterproof sunblock, do they really work?
Well, there's two types of sunblock, really. There's the common ones that, they had when we were kids. That's the, which are the chemical ones that, is the spray-on ones. And they actually have a waterproof component to have it bond to your skin. It helps, but you still have to, and it's still recommendation with those is after any length of swimming or heavy perspiration is a reapplication of that. Now, when we were kids, and I think probably everyone remembers, like the old the lifeguards with the zinc oxide on the nose, the big white, thick, heavy sunscreen that we used to wear.
Yes.
We still have sunscreens like that. Usually, it's a titanium based product is the more common ones, but there's still some with zinc. There are also negative things about basically putting a thick, petroleum-based covering on your skin to hold it in place.
Is that okay for your skin, petroleum-based? Well, that sounds like burning already.
Well, that's like Vaseline or Aquaphor or petroleum jelly, and so that's okay in moderate amounts. Are there problems with that? Clogging your pores? Yes, so you've got to be careful about that. So I don't think it's a very good continuous thing, but if somebody's out surfing all day or going to be out all day hiking or something, and they know that they get like really bad burn on their forehead and on their nose, that's a product to use occasionally on your forehead and your nose to give like really good protection. I mean, somebody like me who's pale as me, I would need that over my entire face. And they come in fun colors like purple and blue, and it's fun stuff.
I can ask Dr. Duffy with all those beauty secret all day long, so we definitely will come back for that. Let's go back to your fitness journey. So you mentioned that, so this is the first experience you have a personal trainer face-to-face and everything.
Yes.
So why don't you share your experience more? So, because most of us, we don't have a personal trainer, and we don't understand what's the benefit and everything, so maybe, it can inspire people because they have different levels of trainers and they have small group, everything. So there are ways people can actually obtain professional help.
I think probably for me the biggest benefit is having someone that I can focus my anger and rage at while I'm lifting weights and stressing out exercising. No, it's like I said, it's really the accountability is good for me because you have your days when you're like, I just want to lay in bed or I just want to sit and have a cup of coffee and not get up. But I've got somebody that's waiting there, that I've committed to going, and that is a great motivator. The accountability is a huge thing. I've had some of my times like when I've been like off my workout binge cycle where I'm going back in, and that's the time, and I think a lot of people that have that weakness will understand what I'm talking about, is a lot of times you will injure yourself because you get back in there and you're like, okay, I'm going to go back to what I was lifting when I was working out every other day or every day 3 months ago. You lift it and you're like, I'm going to do these reps, and you tweak your shoulder, you pull a groin, a hamstring, and that puts you out for another 4 to 6 weeks, and that can be very frustrating. I remember when I started working out with you too, I was pretty out of shape. When I moved to California, like I said, I've been working out pretty regularly. Had put on a pretty amount of decent muscle mass, and that had all kind of gone away. And so you go through this little stage when you start again, where you're deconditioned, you're not lifting as much weight, your cardio is not doing, you're stiffer, you're tighter, and it can be very, depressing. You think to yourself like, oh my God, I really let myself go. Why don't I take care of yourself? And a lot of your little demons in the back of your head start talking to you, and it gets to the point where you're doing it, and that's when it becomes very easy to say like, well, screw it, I'm not going to do this anymore. So having, like I said, somebody that was accountable, somebody who was putting energy into it, somebody that was, calling me, checking in on me every day, and really, like I said, what was nice was, it wasn't I was given a cookie cutter sort of regimen. It was every day you would, see how I was doing and change things up and say, okay, we need to do this. Okay, we need to do this differently. And I do remember it was really hard for the first 2 weeks where, my body was not feeling right. I was having that, that shame and guilt about letting yourself go, looking in the mirror, and, because at that point you start to really look yourself in the mirror and you're just like, oh, I was really being kind when I was saying, my body was still looking okay with that. And I remember it was after the 2-week mark, I was doing 3 days a week with you, and that was it. It was on my days off with you, you had me resting. And it was that Friday, and I think I was working with one of your assistants, with Conrad, and I finished the workout, and it was hell, I thought my spleen or my heart or both were going to explode at the same time. And then I actually, as I was walking out of your studio, I thought to myself, I actually feel really good. And then it kind of clicked. I was like, all right, hard part's over, and I was kind of back into the groove. And then also, I was fortunate for me that, starting at a higher weight and shedding the pounds relatively quickly, I think within probably like about 2 months, 10 pounds were gone.
Yes.
And, that's a lot of good feedback to get just personally when you're seeing like, oh, things are fitting differently. Oh, I'm feeling, less bloated, less unfit.
And then people start to notice the change, and they comment on, you look good, and everything.
Yeah, that happened. Somebody said to me once, it was, when you really start working out, in about 2 months, you'll notice that, a change. In 3 months, people close to you will notice the change, and like 4 or 5 months, people that aren't close to you will notice that. And that's kind of the process I went through. It was like I would notice things were fitting better, feeling better, and then you get a few comments from people at work saying, oh wow, you are losing weight, and then you'll see people that you haven't run to for a while, and they'll look at you like, I just had a patient that yesterday or 2 days ago. I saw her in the preoperative holding area doing the review of her history and making sure she had no questions. She was a Spanish-speaking patient, so I was using my Spanish as best as I can, but then I need to get a translator to make sure that everything's clear with them. And then when I got my assistant to help me translate and pulled my mask down, the woman, she gasped and she said, oh my God, I thought you were a different Dr. Duffy. You were so much fatter before. And I smiled and I was like, oh, you're going to get an extra tummy tuck today. I'm going to give you a tummy tuck. And, we laughed, and it was very funny. But that was great. That was a very positive feedback. It's good to get that feedback. I mean, you do something like this for yourself, yes, we're Americans, yes, we live in Southern California, so there's a lot more body consciousness and appearance consciousness here. But it's also, it really is, if you're not doing it for yourself, I think you've got a lot of hurdles in front of you. If it's really got to be something that you do because you're doing this for yourself. And
for a lot of us out here that we still cannot have that first step to to eat healthier or to, just walk around the block or to sign up for a gym or to do that, what's your experience and your thoughts, and you can share with us, to have that first step to really tell yourself that I was too kind to myself before, looking at the mirror and everything.
Yeah, I think it is. I think when you get the impulse to take that first step, because once you've got that first step out of the way, you now have momentum. So yeah, I will say that yes, the first step is the hardest. That first, decision, I'm going to do this. I'm going to take on the expense. I'm going to take on the time commitment. I'm going to, I'm willing to do some lifestyle changes. And, in terms of some of the lifestyle changes, it's a weird phenomenon too. Like I'll go out with people to a restaurant and, my alcohol consumption's gone down. And also even at restaurants, I'm trying to be much better about, making healthier choices. And a few times people, be like, hey, pushing the alcohol, pushing, hey, let's get to desserts. And I'm not going to be a jerk about it. When there's like, a hot fudge sundae at the table and 4 spoons, I'm going to use one of those spoons. But just enjoy a little taste and, join in with everybody. But I think it's really that once you make that decision, to take this on, to decide like, yes, I'm worth it. It's worth investing this into myself, and I'm doing this for myself. It's that, like I said, that first step, and then you've got the gift of momentum, and that makes it, because step number 2 is going to be easier than step number 1.
Things for physics, momentum.
Yeah.
So the social event, like you mentioned, the doctor office, the break rooms, the social event with peers, and you have alcohol, like, friends are pushing for alcohol, and so what's your strategy when everybody's drinking and it's like, hey, you're not drinking with us, what's wrong with you? You're not you're a party pooper and stuff like that. What's your strategy to
if I'm at a party and there is there's a lot of drinking going on, I will always have a drink or two. I do enjoy a drink with friends, and that social aspect. I get the little hall pass if I can easily say, if somebody's really pushing me, I can say, no, I got surgery tomorrow, or no, I'm on call. I mean, that's a little bit of a hall pass, which I've just destroyed. Now all my friends that hear this are going to be like, no, you're not, have another drink. But I think if you've made the decision, you made the commitment, and you've spoken to people about that. I think if you say to somebody that's your friends, is saying, hey, I'm really focusing on this right now. It's 1 drink a night, or a drink before dinner and a glass of wine with dinner, but then that's it, or no alcohol. If that person isn't understanding of that, well, that's a little speed bump in the friendship. It's not like you need all of your friends, putting on cheerleader outfits and supporting you and like that. But I think people have to understand, if they care about you and you care about yourself enough to make this commitment, they should have some respect and understanding for that. And occasionally, yes, there'll be the party, or like if people are in town, you give them a hall pass for that, and you're like, okay, you can give me fucking, But I think that like I said, if you've got friends that care for you and have an understanding of who you are, and know that you've made a decision to approach your nutrition and your health this way, they should be understanding of that.
Yeah, I actually, throughout my years of experience, it's very helpful for your family, for your friends, for your social circle to understand your fitness goals and then what you're trying to do. And usually they're very supportive and would help you and remind you.
Yeah. Oh, yeah. I get reminded by some people. Sometimes I tell the people at work, if I am having a cracker, that they don't need to scream at me and tell me that they're going to threaten that they're going to tell you. It's more of a long-standing joke with them. But yeah, nowadays too, especially like if you go to a party or a house, like whenever I have people over at my house, I've always had like some things for the vegetarians, some things for the vegans, or some things that are a little bit on the healthier side, some little things. So usually it's very rare that I've been in a situation since I've really decided to be consistent with my nutrition, where I've been to a party where I've said, or a social function where I've said, oh wow, I can't have anything. That's very, there's always a crudité things or something like that to snack on.
It's great. And then being a great cook and a great baker yourself, share with us how's your sugar strategy, because I mean, yeah, your bakery goods I tasted too, right? The mango bar and my chocolate cake, birthday cake, they're so awesome. But yes,
that is I do like to cook. It's more of it's a communal sort of a sharing thing. So, I'll go over to some of my good friends' houses and we'll all cook a dinner together. And, a lot of times because I'm pretty good with the baking, I'll be the guy that brings the desserts. Then I'll have a little piece of it with them, but not go crazy. There's this interesting phenomenon, I think, when you cook, because as you're going through every step of making it and having to taste it to make sure it's right along with the way, by the time the finished product comes along, you're like, where, if somebody makes you a box of macaroni and cheese and on the stovetop and puts it in front of you, you're like, oh my God, this is the best thing ever, thank you. So that kind of keeps me, honest. In terms of the baking thing, people ask me, it's like, how do you do it so well? And I'm like, I always tell them, I did a lot of organic chemistry before medical school, so I just go into this crazy sort of OCD stage where I convert everything to metric, to grams and milliliters. I have a little scale to do everything out to grams and milliliters, and I just follow the recipe. Like I have ADHD, I do exactly what everything it tells me to do. Completely zen out, and if you do that, it's going to turn out pretty good, I think. So, that's really it. Like I said, now when I'm cooking something, when I'm having people over, I've always made sure that I had things for the vegetarians. A little bit more plant-based is my diet now. Making sure, with all of the changes you had for me with my nutrition, in order to get fiber and everything in, I'm eating a lot more vegetables, and that's always a positive.
Yeah, and like you said, with a bigger goal to fulfill every single day, 200 grams of protein and 40 grams of fiber, and everything there in place. It's already you use that entire 2,000 grams calories
to get that in there.
Yes. Yeah. And then the little things like the sugar and the things that they just don't even have a place.
Yeah, they're like they should be. They're the little treat, little something every once in a while, but not. It can't be a regular part of my regimen right now. I just can't fit it in.
Yes. So we are 9 months away from 8 months. 8 months away from
Burning Man. Oh yeah, that was
yes.
that was one of the things I had said. I was like, I need my Burning Man body back. Yeah.
Yes. So for this next 8 months, what with your very busy schedule, because right now the business is very busy.
Yeah.
You're operating a lot and everything, and then so how to fit a important fitness regimen and the nutrition, regimen into a very busy professional lifestyle, and then still going to crush that goal in 8 months.
I think the reality is, even that nowadays, especially in Southern California, there are a lot more healthy choices, and having healthy food is always available for you. You've got to do some planning in terms of your nutrition, and on the weekends I'm cooking a bunch of vegetables and some meat, things to have on hand in the refrigerator. Some people I know will measure everything out and put them in little separate, containers so that you can just grab and go. I generally don't do that, but, the night before I will measure out and get myself my lunch and a snack or two, because otherwise, if I'm just putting myself, if I'm at the hospital, at what is available in the cafeteria that day or what I can run out and grab, it would really be very difficult to keep what my nutrition goals are with that. So doing some type of meal prep is just a reality of doing that. Making sure that before I go to bed at night, I've got my 2 little shaking containers with the protein shake in it, so I can just grab it, shake, chug it down, and be done. In terms of the exercise, that's probably where having a trainer really helped a lot. Again, with that accountability, because yes, now more so than during the pandemic, I've got the days when I wake, when my alarm goes up at 6 o'clock, and I say I don't have to be at the office until 9 o'clock, but I'm planning on coming in to work out with you. where every cell of my body is screaming, just like hit the snooze button, roll over and go. But, you know, because there's somebody waiting for me that's got that regimen, you know, I'll do it. I think there was one time that I did it, and your response was like, okay, you can come tomorrow morning then. And I was just like, oh, I didn't really get out of that. I just kind of pushed it off a day. So that,
you got Peloton, so let's just on Peloton today.
Yeah, I was just like, I think it was like, go for a Peloton, run around the Rose Bowl today, then, and then we'll do it tomorrow. And I was like, oh, I got, that didn't work. I got penalized for that. So yeah, and that's good. And also, you know, the other thing that happens, I think a lot of people experience, is the dreaded plateau phase, where you're seeing improvements, things are getting better, you're noticing that your strength is better, your flexibility is getting better, your energy level is getting better, and then you hit that plateau, which I'm sort of at right now, where it's everything maintains, but it's not. It's those increases you were really enjoying, giving a lot of positive feedback, are now sort of plateauing, and that can be very stressful. So I know there are times, like when I've been with you or working with, you know, one of your assistants, where it was the plan was to do something, but they just took a look at me, they took an assessment of me, and that day's routine changed for me, that I think that's really helpful in terms of, you know, maintaining during that plateau phase and getting ready to like move on to the next leap.
Yeah, our body all have this plateau. My personal plateau is about 130.
Mm-hmm.
Like, you know, it's very hard for me. I have to do like so much more work. I have to eat like a crazy healthy, no wine, you know, and then sleep 8 hours, and then to make sure I can get under 130. So yeah, so 3-4 years ago when I was going crazy with my, you know, that was when I first started social media. So I was 14% body fat.
Wow.
I was 126, but I had to do everything to make sure I look, you know, like a picture ready cut.
Yeah.
And now, you know, I'm 48. I'm very happy at 134 to 135.
Yeah.
And I mean, yes, I'm not like a crazily cut, but I feel great. I gained back my hormones, and then I had my period, and then you know, everything. So I feel great.
Yeah.
But you know, everybody has that plateau. Yours is 210.
210, yeah, 210 is a cutoff. And actually, you know, in past, it's I'll stay there for a little while, but then I'll go through a drop phase where, and all of a sudden it's like 210, 208, 204, 205. You know, it's just for some reason, I don't know if that's my body's physiologic comfort level, where it's just like this amount of fat, this amount of water, this amount of muscle is...
Yeah, your body is comfortable. It feels safe.
This is the best, you know, ratio to keep us from being eaten by predators. You know, for some reason that's what my brainstem thinks is good for us.
Yes, but we'll get over with this plateau and then go to the next phase.
Oh yeah.
Yes. And so with your busy work schedule and so the workout, so your thought to share with us is, you know, have the accountability.
Accountability is good, and then planning. It's not you can't be cavalier about it. You know, like I said, along with the commitment, just an awareness that, you know, when I wake up, I've got to be functioning relatively early, longer days. I've got to really have a strategy for keeping my nutrition the way I want it to be. You know, for the working out with the accountability, it's great because it's just all I've got to do is roll out of bed and show up at the studio, and then that's taken care of. Or now that, you know, I'm further along, I've got on my days that I'm not working out with you, I've got my home workouts and cardio things to do, and that really just gets, you know, to quote a shoe, it's just just do it. Just, you know, get your butt on the bike, get your butt to the Rose Bowl, and, you know, run around it. Just get there.
You also have a plan that's really important. Instead of, you know, have to overcome the initiative motive to even do it, and then, you know, once you're there, you don't even know what's the plan that day or that month.
Yeah, I mean, I think that's true of any athlete or anyone that you know, really spends a lot of time, you know, investing in, like, you know, with their health and nutrition. You know, if you know, people that I've known that are like sports models, they don't just show up at the gym and be like, what do I feel like doing today? They've got a game plan for that. And so I think that, you really need to have something in place that you can just follow and keep yourself, on track.
Yeah, it's really important to have a game plan.
I think that, I moved here right before pandemic and lockdown. So what I envisioned as being my experience, ingratiating myself into to life on the West Coast, really, had a big monkey wrench thrown in the machine works of that from the pandemic. I remember it was maybe it was about 4 months ago.
Yeah.
When things really began to open up. People were adequate number of people were vaccinated, and getting tickets to a great show that I wanted to see. The artist I'd followed for a while, and took a bunch of friends, and it was a great night. Where we met at my house, we had drinks, we went over to the venue down in Hollywood. The show was great. It was a small venue, about 1,000 people, so it was a really intimate show. Came back to my house and, had a few more drinks. I had a great time, and I told one of my friends the day after, and I said, that was the sort of LA experience that I was, anticipating as I was driving cross country, to come over here. I laughed, and I was like, I guess expectations are the seeds of disappointment with that one. But, as soon as I did that, I said, well, gosh, I've been, basically sequestered like everybody for about 1.5 years now. So I was just any opportunity to go out, any opportunity to see a show, any opportunity to go to, meet people for drinks. It was very, some hyper sort of carpe diem attitude to it. And as a result, with starting to get my practice off the ground and working with you, I was exhausted all the time. And, I got that out of my system. For, maybe about a month, I was out every Thursday, Friday, Saturday night.
Dancing till 2, 3, 4, 5 o'clock in the morning.
It was really, really.
I love your passion of life, though, really.
Yeah. Oh, it was great, too, because the weight was dropping when you're out dancing all night. But yeah, no, balance, returns after about a month of that. It just became clear. I was just like, okay, I still try and, enjoy the city and the West Coast as much as I possibly can. But, a little balance is restored in my life. And, now it's, if I'm tired, I'll know that, okay, it's time to sleep and stop.
Yeah, I remember at that time we talked about, our fat really doesn't metabolize out when we work out hard.
No.
It really processes during when we sleep and when we're fully recovering.
Mm-hmm.
So at the time, you worked out so hard, but there was just not adequate rest.
Yeah.
So, your cortisol is still there, your stress is still there, and then so your fat is not, melting away. So that's when you actually said, all right, you just have to put priority in place. Yeah. And that is very important.
Absolutely.
All right, so now being a plastic surgeon in our beautiful LA, so tell us about some misunderstanding about plastic surgery.
It's very popular in mainstream. There are a lot of, there have been television dramas about it. There are television reality shows about it. It's very much on the forefront of people's discussions. So there's a lot of misinformation. And some of the ones that I really run into, maybe relating a lot to what we're talking about, is a lot of the body contouring discussions I'll have with people, usually about liposuction or abdominoplasty, tummy tucker, things like that. And there's a little confusion about weight loss versus body contouring. Something like liposuction, in my opinion, it's something that works very good for somebody who's at or near their desired target in terms of weight and body shape, but there's a problem area that they just can't get it. For women, it can be the thighs. For men and women, it can be, sort of the love handles that go towards the back area. For men, it can be the gut a little bit. And I think things like liposuction, body contouring, those work great for that when you kind of point to the problem area. It's always a struggle when I have somebody that comes in that is sort of, when I ask what area they want to address, they kind of rub their hands over their entire body and say, I'd like all of this to be addressed. And that's when I have to have a discussion with them about, nutrition and weight loss, and that I tell them that I think that if they want to have body suction, liposuction from nose to toes, it's going to be probably very disappointing for them. I'll tell them get on the program with some nutrition, get your body a little bit more in shape, and then let's talk about, is it the waist that needs refinement? Is it the back? Is it the thighs? Is it that one area? And then we can balance it out for them. So that's always a little bit of a struggle that I have sometimes with patients. In terms of one of the things that's very difficult with patients, like when I'm consulting with people for breast augmentations, especially, they will bring in a photo from an advertisement of a model that has a beautiful body and beautiful breasts, and they'll say, I would like my breasts to look like that. And again, I've got to tell them, I got news for you. Her breasts don't look like that. That's a huge.
So that was just Photoshop, or
Photoshopping is used a lot in print advertising. It's very common. It doesn't mean that model doesn't have beautiful body, beautiful figure, beautiful breasts, but sometimes that can sort of set up unrealistic expectations. And I think that it's the responsibility of your surgeon to make sure that your expectations are on par with what your results will be. If there's a disconnect, it's sort of the surgeon's responsibility to bring you to a balance of what your expectation should be, and if that can't be reached, refuse this, or just say that I'm not going to be able to provide you what you want. It's not appropriate for me to operate on you.
I have actually a lot of people thinking the liposuction, they can, drastically and quickly help them to reduce like 15, 20 pounds, that kind of thing.
That would be a very large volume of liposuction. You can take that much off of somebody, but really you're not supposed to take 5 liters is sort of the common, what is
5 liter of fat is how much pound? About
that can be about like 8 pounds. It's different because
so that's already in the max high side to take out the fat.
As an outpatient, usually we say it's 5 liters is the recommended amount that you can do. At the American the American Society of Plastic Surgery recommends that anything higher than 5 liters needs to be done at an inpatient setting where you spend the night, because then you've got to do monitoring of fluid shifts of electrolytes in that patient. And most patients nowadays are not willing to take on the fees of an overnight stay in a hospital for elective cosmetic surgery.
Yes, so I think this is a huge understanding of thinking that the liposuction can just help reduce 20 pounds in one shot.
In terms of weight too, you got to remember that fat is much less dense than muscle or bone or water. So the same volume of fat, 2 liters of water, which is about 4.5 pounds, 2 liters of fat is going to be less than that because fat doesn't have the density
so 5 liters of fat is even less weight than 5 liters of water from your body. Yeah, so let's keep that in mind. We need to do the lipo. And there a good advice that you can advise us before or after plastic surgeries, or anything happened during your professional career that afterwards people's some behaviors that led to undesirable results, or
I think the biggest concerns I have with a patient is when I've taken on patients who are smokers, because smoking does really affect your body's ability to heal. It really constricts your blood supply. So, and healing, needs good blood supply. So, I believe almost every plastic surgeon will tell you that somebody who's an active smoker, somebody like that, they're not really a candidate for a tummy tuck. They're not a candidate for a facelift. They're not a candidate for a breast lift because the healing can really be impaired by that. And I've had a few patients that have told me, that they've quit smoking. They even sign something in their consents that they've discussed the risks of smoking and healing, and they're aware of that. And they have had hard healing problems, and I've done a blood test to look at, if they've got metabolites of excess nicotine in their body, which means they've been smoking, and across the board, those people, they always have it. And I just tell them, I was just like, you've really, all the work that you've done, that we've done, the expense you've taken on, you've sort of wasted it because of that. I used to be a smoker, so I'm not going to get on a soapbox and, scream about it. I know it's very hard to quit. It's a difficult thing, but it's just a reality of plastic surgery that, if you're looking at, we're dealing a lot with scar placement, incision placement, and trying to get the optimum healing to minimize, scarring. And if you're doing something like that, you're doing something that's going to guarantee that you're going to have very bad healing. So that's.
So how about pot marijuana? Does that
no,
delay healing?
It does not to my understanding. I haven't really seen any data on that. The real issue with cigarette smoking is the nicotine. It constricts your blood vessels, and that's what basically decreases blood supply. And especially if you're a multiple cigarette a day smoker, you've just got that generally constricted blood supply. That's why blood pressure is a problem with people who smoke. So there's not that nicotine component in marijuana products. I don't know about any other studies that have been done for wound healing. I think there have been some that I've seen about negative effects of smoking marijuana, taking the smoke in, but I think that's not a stretch, that anything that you take that's a hot gas into your soft little pink gentle lungs is going to be hard on them. So,
what about alcohol? Like, I love my wine. And so before I do my plastic surgery, isn't any...
I will tell people, when after surgery, obviously if you're taking any kind of like opioid medications for pain medications, you're not supposed to take alcohol with them because they potentiate each other.
But before surgery, there's no conflict?
Well, the problem with alcohol, it has blood thinning properties to it, and that can make surgery more difficult. So I'll tell my people that are drinkers, I just tell them, a week before the surgery, a glass of wine a day is fine. A glass, like a 4 to 6 ounce glass, not a 14 ounce glass of wine.
I know.
That doesn't count.
You know my glass.
Yeah. I was going to say, if it takes 2 bottles to fill the glass, that's too much. And then I'll tell them a few days beforehand, no wine. And I've had a few people that say that that's going to be a struggle for me, and I've kind of gently, compassionately said, maybe that's something you want to look at.
Okay, so just a week before, so I can do that. And any other, like any fun experience or unforgettable experience happened during your professional career? The surgeries and then.
Going through a surgery residency, people always ask. I've had people ask me the question about which television show, medical television show, is the most like your surgery residency, and I think almost every doctor will say probably the one that got it close enough was Scrubs. It's a very surreal experience going through. I think any medical training, definitely surgical training, was where there's just different experiences. Hard to know what to share about that, because of privacy issues and things like that. But there's definitely some wacky ones.
So any final advice that you can share with our people for fitness, nutrition, a stressful life, according and then still reach your goal? And the Burning Man in 8 months.
Burning Man in 8 months, if I can get a ticket. In terms of, I really, it's that first step is the hardest part. But if you can do that first step, like I said, then you've got the gift of momentum, and that takes you to step 2 and 3 and 4, and before you know it, you're walking along a really good path. And then the one thing that I always remind, myself and, everybody, especially like when they're coming across something, especially, health and fitness, saying, oh, I can't do that. Oh, I can't do that. I'm not going to do that. The world is full of people who will tell you you can't do something. They don't need your help. Do it.
Perfect. Any other fun questions? All right, I'm sure that Dr. Duffy will be back. We'll have a lot of other questions about our beauty and skin and everything. Thank you, Duffy. Thank you.
All right, thank you for having me. It's been a pleasure.